Good day. My name is Jaira R. Omopang from BSN Level 1 and 15, and today I am going to perform the assessing the abdomen. Abdominal assessment is evaluation of the abdomen, liver, and bladder involving four methods of examination, which are the inspection, auscultation, palpation, and the percussion. So, the first thing we do is to determine the client's history of the following: incidence of abdominal pain, its location, onset, sequence, and chronology, its quality, its frequency, associated, and the symptoms. Also, the bowel habits of the client, incidence of constipation or diarrhea, change in appetite, food intolerance, food ingested in the last 24 hours, specific signs and symptoms, and lastly, the previous problem and treatment. After identifying or determining the history of the client, we are going to assess the client to a supine position with arms placed comfortably at the sides. We are going to place small pillows beneath the knees and the head. We should also expose only the client's abdomen from the chest line to the pubic area. And now, we will going to inspect the abdomen. Inspect the abdomen for its skin integrity. Inspect also the abdomen for contour and symmetry. We will going to observe the abdominal contour while standing at the client's side when the client is in supine. Ask the client to take a deep breath and to hold it. We will also going to assess the symmetry of contour while standing at the foot of the bed. If distension is present, measure the abdominal girth by placing a tip around the abdomen at the level of the umbilicus. Also, observe the abdominal movements or associate with respiration, peristalsis, or aortic pulsations, and observe also the vascular pattern of the abdomen of the client. And now for the auscultation of the abdomen, we will going to auscultate the abdomen for the vowel sounds, vascular sound, and peritonical friction rubs. And now, we will going to proceed to the percussion of the abdomen. Percuss several areas in each of the four quadrants. Use a systematic pattern. Begin in the lower left quadrant, then proceed to the lower right quadrant, and to the upper right quadrant, and the upper left quadrant. So after percussing the abdomen, we will going also to percuss the liver of the client. Begin percussing the abdomen along the right midiclavicular line, starting below at the level of the umbilicus. Move upward until the percussion notes change from tympani to dullness, usually or slightly below the costal margin. Mark the point of change with a felt tip pen. Percuss downward along the right midiclavicular line, starting above the nipple, moving downward until percussion notes change from normal lung resonance to dullness, usually at the 5th to 7th intercostal space. Again, mark the point of change with a felt tip pen, and also we will going to estimate the liver size by measuring the distance between the two marks. So marking will not be able to see or in this return demonstration because of the lack of equipments, but it should be done with to measure the liver size of the client. And now for the palpation, we will going to perform light palpation first, symmetrically explore all four quadrants, and perform deep palpation all over four quadrants. So, for the palpation of the liver, we will have two method. The first is the standard palpation, wherein we will going to place the patient in a supine position. So we already did, and stand at the right side of the client. Place your left hand under the client's back at the approximate location of the liver, and place your hand slightly below the mark at the liver's upper border that you made during the percussion. Point your finger or your right hand toward the patient's head just under the costal margin. As the patient inhales deeply, gently press in and up on the abdomen until the liver brushes under your right hand. And note for any tenderness. Now, for the second method, which is hooking the liver. Stand next to the patient's right shoulder facing her feet and place hands side by side and hook your fingertips over the right costal margin below the lower mark of dullness. Ask the patient or the client to take breath as you push your finger in and up. So, ma'am, while doing this procedure, can you please breath? Okay. Okay, ma'am, breath. Okay, ma'am. Thank you. So after the liver, we will going also to palpate the bladder of the client. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. And after the assessment and after the 4 methods of examination, we will going to document findings in the client's record.